Hi, I'm Michelle Murphy. This is my client, Emily DeVue, and I'm filming this in my house in Ottawa, Ontario, Canada. First thing we're going to do is we're going to test the 4 ligaments in the knee, the MCL, the LCL, the ACL, and the PCL. So the first thing that we're going to do is we're going to do the valgus stress test for the MCL. So the first thing that we're going to do is we want to be on the outside of the knee. You have the leg in between your body and your arm, so you have this hand free. And then you're going to take your index finger and run it down until you feel a divot in the femur. And that's where the MCL is going to be located, so you find that divot. You're just going to take your index finger and place it there. Okay, so you're going to take the palm, but it's just going to be on the joint of the lateral side, so right here. And then next thing that you're going to do is you're going to give their knee a little bit of a shake, like that, just to loosen up the hamstring because it's going to want to tense up when you have it in this position. So you're just going to give a little bit of a shake, and then you're just going to bend it in a slight 20-degree angle. Like you can go ahead and apply a valgus. When pushing valgus, more towards the inside of the knee. So a slight bend, and we're just going to go ahead and push. And this is just going to help to open up the joint line. Make sure we're not going to apply too much force. My body isn't moving or anything. We're just pushing valgus to the knee, like that. A positive would be if they're feeling any pain or if you feel a gap in between the joint. It opens up and then you also hear it close. So that would be a positive. Okay, so next what we're going to be doing is the varus stress test. So this is when we're going to be testing the LCL. And this will be on the lateral side. So what we're going to do is we're just going to sit on the inside. We're going to have her leg in the exact same position as before. Everything will be the exact same. But instead we're just going to be pushing posteriorly, so to the outside. So we're going to go ahead and have her leg in between my body and my arm like this. So I have this hand free. We're going to find the joint with your finger, find the divot, and that's where the ligament is going to be. So you're going to have your hand here, and you're going to take your other hand, your free hand, just place underneath on the medial side, have a slight bend in the knee, give it a shake to loosen up the hamstring, and then we're just going to twist the leg or push leg posteriorly, so to the outside. So slight twist, like that. Alright, and so a positive would be if there's any pain or a gaping in the joint. So now we're going to do the ACL and the PCL. So for this we do an anterior drawer. So if the ACL is ruptured, when I pull on forward, the tibia will shift forward. And what the ACL does is prevent it from shifting forward. So if it's ruptured, then the tibia will shift forward. So for the anterior drawer test, we do have to disengage the hamstring because when we go to pull the tibia forward, the hamstring is going to contract and it's going to kind of restrict you from pulling, so you're not going to get an accurate test. Alright, so what you're going to do is you're going to have the knee bent like this. Your index fingers go in behind the knee hook, find the lateral and the medial hamstring, and you're going to hook up and in. You're going to pull the tibia anteriorly like this. And a positive would be if there's any pain or if the tibia shifts forward. This is the PCL test. We're going to do the same thing as what we did for the ACL test. But this time we don't have to worry about the hamstring because we're actually pushing anteriorly, so backwards. So we're going to be applying a posterior force. So we have our fingers, index fingers hooking up, our thumbs on the tibia, and we're just going to be applying a posterior force, which means we'll be going backwards. So we're going to push. And a positive would be if there's any pain or if the tibia starts to shift posteriorly and it feels like it could keep going. Okay, so the next test we're going to do is for the meniscus, and it is called the Thessaly test. So what we're going to do is we're going to hold into my hands like that. This is going to test either the medial or the lateral meniscus. But we're going to have the patient stand on her injured leg, like that. And she's going to have, so we're going to have her stand on her injured knee. She's going to apply a slight 20-degree bend, and she's just going to rotate from left to right. This is holding my hands is just, it's going to help her keep her balance. A positive test will be if there's any pain or if there's any locking in the knee. And that's everything.